Hello, my name is Ayla Glisson, and I am an MLT student at Motlow State Community College. And today I am going to present a case study over ovarian cancer. What is ovarian cancer? Ovarian cancer is a harmful illness that starts to affect the ovaries first and then spreads throughout the body. 2 ovaries, one on each side of the uterus, make up the female reproductive system. Each ovary, which is about the size of an almond, produces ova, which are the female egg, as well as the hormones estrogen and progesterone. This cancer is frequently misdiagnosed until it has progressed into the abdomen and pelvis. The treatment of ovarian cancer at this late stage gets riskier. Early stage of this disease, which is limited to the ovary only, can be treated very effectively. The illness is often treated with surgery and chemotherapy. Now I'm going to talk a little bit about the history of this patient. The patient in the given case study has had stage 4 ovarian cancer for 9 years and has not had a total reduction since the initial decline. The long-term existence of the patient can be attributed to cancer cells' moderate development, limited metastasis, and successful therapy responses. The patient primarily presented with a malignant pleural effusion that was not treated because of the ability to withstand surgical procedures. Nevertheless, several treatments, like long-term post-operative chemotherapy, interval cytoreductive surgery, and pre-operative surgery chemotherapy, were used to measure the illness. The laboratory results for this patient are as follows. The white blood cells were counted at 1.72 times 10 to the 9th power per liter. Platelets were counted at 7 times 10 to the 9th power per liter. They started the patient on 200 milligrams of irinotecan and 40 milligrams of loboplatin. After 1 month, CA-125, which is cancer antigen 125, was at 54.48 units per microliter. Irinotecan was increased to 260 milligrams for 2 more cycles. CA-125 levels continued to rise, reaching to 85.93 units per microliter. The CA-125 levels continued rising for another month, so the medications used were switched to irinotecan and netaplatin. This improved the results. CA-125 was much higher at 321.2 units per microliter. The patient then developed severe bone marrow destruction, which caused her white blood cells and platelets to considerably drop. White blood cells dropped to 0.4 times 10 to the 9th power per liter, and platelets dropped to 2 times 10 to the 9th power per liter. The patient also developed gastrointestinal bleeding, and both of these were treated symptomatically. CA-125 rose up to 2,223 units per microliter. Due to the severe gastrointestinal bleeding, the patient was admitted to the hospital. There was a recurring pelvic lesion measuring 9.27 by 25.5 centimeters and affecting the rectum. This was found using positron emission tomography. The testing used for the diagnosis. As per the test results performed by the doctors, the rate of CA-125, ultrasound, and other things showed the presence of supraclavicular lymph nodes. In addition, these results collectively showed metastasis stages that suggested the patient had an advanced stage of 4 ovarian cancer. Confirming the diagnosis. To confirm the diagnosis, a biopsy was performed on a CT-guided pelvic mass. Papillary endocarcinoma of the reproductive system was identified during histopathological testing. Because the patient could not endure the operation, neoadjuvant chemotherapy was examined and provided 4 rounds of paclitaxel and cisplatin. The peritoneal effusion, pleural effusion, and tumor thrombus in the right internal jugular vein all went away. Interval cytoreductive surgery was conducted after the patient's physical state improved. Undifferentiated cancer on the left ovary was discovered during a routine post-operative pathological investigation, together with right ovary metastasis. A CT scan revealed a pleural effusion on both sides. Later, in August 2015, the patient was admitted to the hospital due to severe gastrointestinal bleeding. Now I am going to talk about the treatment that was used for this patient. After 3 cycles of post-operative docetaxel plus carboplatin treatment, the serum CA-125 levels reverted to customary. A pelvic lump measuring 2 centimeters in diameter was seen on a CT 19 months after surgery. The level of serum CA-125 had grown to 42.7 units per milliliter. A total of 4 sequences of second-line treatment is based on liposomal doxorubicin plus trabectedin. CA-125 levels after that returned to normal. Now we're going to move 7 months later into the treatment. CT scanning discovered that the sigmoid colon's CA-125 level and left anterior part had risen to 122 units per microliter once more. After 8 cycles of third-line docetaxel and carboplatin treatment, the level of CA-125 had dropped to 9.46 units per microliter. The level of the patient's CA-125 status had risen to 304.6 units per microliter during the 1-year follow-up. A hypoechoic solid lump in the pelvis was discovered by ultrasonography. Due to significant toxicity, the 4th-line topotecan-based chemotherapy was altered to 1 round of carboplatin and paclitaxel. During chemotherapy, CA-125 level of the patient increased gradually to 453.1 units per microliter. The management was modified to a combination of oxaliplatin and vinorelbine for 6 cycles. The CA-125 levels dropped to 21.37 units per microliter. Due to relapse, the patient was hospitalized after 5 months. After that, the patient received 2 cycles of gemcitabine and capecitabine, followed by 4 cycles of gemcitabine and cyclophosphamide. Following this round of treatment, the level of CA-125 was 84.07 units per microliter. After a 1-month relapse, the patient was given an epirubicin and vincendazine regimen for 3 cycles. In addition, 6 cycles of netoplatin and vinorelbine combo regimen have been provided. The CA-125 level had dropped to 8.95 units per microliter after completing this course. After then, the patient's health stabilized and they were closely observed throughout follow-up. In conclusion, the disease relapsed several times and developed resistance to chemotherapy. However, with proper treatment changes, the patient's condition was very well measured for a long time. Unfortunately, the patient eventually died 9 years after the initial diagnosis. To end this presentation, I would like to thank you all for your time and allowing me to discuss this case study over ovarian cancer.